you go.
Okay, thanks, Kathy.
Sure, thanks, Denise. So, good morning, everybody. I'm going to talk a little bit more about the nuts and bolts of how to take a caregiving leave and understanding the process and your benefits. And just a little background on me. I was a part-time caregiver for my mother who had dementia and a respite caregiver for a friend who had motor neuron disease. But the reason I think Denise asked me to do this presentation in particular is that I've just completed 22 years managing human resources for a small nonprofit in Massachusetts. So we've had some experience with people taking leaves, not only for themselves, but to care for other people. So I'm hoping to bring that to bear today. Sorry, I'm having trouble. There we go. So here's the situation you may be facing. You're beginning to realize that you may need to take time away from work to be a family caregiver. What do you do? And Denise touched on some of these things. I'll just elaborate. So the first thing to do that I would suggest is gather information. Determine what your caree needs. Will it be full-time care, transportation to appointments, or periodic support? Some people find that their situation means that they need to take whatever the maximum amount of leave they can take from their job is at one time. Some people find they may need to take a week here, a week there, or time to take someone to an appointment or to treatments, or even just time to take someone just to a medical appointments. So any of those, are possibilities, should be possibilities at the workplace. As Denise mentioned, talk to your employer about your situation as soon as you think you may need a leave from your job. And Denise is right about all the people you need to talk to. Interestingly, what I find out is people will come to me in HR and say, I need to take a leave and I need to talk to our boss, but I'm afraid to. And so I end up coaching them through, what to say to their supervisor, so that they go through that step and then can come back and go through the process of applying for a leave through the HR channels. You should ask what federal, state, and employer benefits you have that may cover the leave. And as I'll get into shortly, there are different benefits available to you. And also discuss what modifications the employer might be willing to make. And for example, you may have paid time off that you may want to use, especially if it's just a few random appointments. And that may be something that's available to you. It's, of course, up to you how you want to use that. At our organization, we have a PTO pool when we know that somebody is in a situation where they probably need more paid time off than they have. And so what will happen is everyone who wants to will donate a day or a certain number of hours to the pool to get that person more paid time off if they need it, which is a really lovely thing. Some people aren't comfortable with that, but if you are, it might be something to ask if your employer has. Sometimes you can just ask about flexible hours. Let's say that you usually work from 8 to 4, but the appointments that you need to get to are at 4. So maybe you work from 7 to 3, or maybe you work, if you're not working full time, maybe you work more hours one week, a few hours the next week. And again, as Denise mentioned, this is also the sort of thing that you need to make sure is okay with your work team, your department, or anyone else who's affected. Sometimes job sharing is a possibility. I know my very first job, I think, was when someone I knew was working full-time at a company and she needed to leave to take care of her daughter at a certain point every day. So I lived next door and she asked if I could work the other hours for her. So that worked perfectly for her and obviously involved a reduction in her pay. But if that's something that's feasible for you, something to consider. Remote work might be possible. Again, if you're caring for somebody, it might not be possible for you to be doing remote work at the same time. But if it's something that works in your situation, it's a possibility. One other thing I'll mention, and what has always been the first line for us in HR where I work is the employer-sponsored insurance plans. Now, I will say the employer our employer-sponsored insurance plan at this point, our short-term, long-term disability plan, does not cover caregiving leave. My understanding is that some plans are starting to. So another reason why it's always good to check with HR, because things are changing all the time and you just never know if there's something you can access there. However, the thing I will say is that for us in Massachusetts, which is where I am, now we have a state family medical leave program, and that takes priority over any private plan we have. So that's a little dance I'll be talking to you about a little later. And again, there is a Family Medical Leave Act, a federal law that assures you unpaid leave if you are employed by employers who meet the criteria, which we'll go into in a minute, and state programs. I think there are 16 states that currently have or are about to have programs, and usually those programs are paid leave. So those programs can be very helpful. So just to give you a little overview about FMLA, the Family Medical Leave Act, and I just want to say that basically what I've selected here is the information that's particularly pertinent to family caregivers. If you have a situation where you have a member of the military, current or former, that you're caring for, or in some cases, certain industries, there's actually a lot more information to this that you'll want to look up, and there's a link at the end that you can access there. But basically, I'm just basically paring it down, trying to make it as simple as possible. So the Family Medical Leave Act provides up to 12 weeks of time off unpaid in any 12-month period. However, your employer must qualify. So your employer must have 50 or more employees or be a public agency, elementary or secondary school. Now, the place where I work, even though it's a school, is not an FMLA entity because we are considered a daycare more than an elementary school. So this doesn't pertain to us. So it's important to check with your HR and see if FMLA pertains to your employer. In addition, you must qualify. You must have worked for the employer for at least 12 months and at least 1,250 hours, I believe, during those 12 months. It is recommended that you give the employer 30 days notice if possible. We all know that sometimes it's just not possible. And you will need to provide medical certification that your caree needs to go to the appointments, to have someone with them all the time, et cetera, if the employer requests that. So here are the conditions that qualify for FMLA leave, assuming those other conditions are met. Your spouse, child, or parent has a serious health condition that requires an overnight stay in a hospital or medical facility. So let's say there's a fall and your caree is transported to the hospital. You need to spend several days just managing that hospital stay, and or possibly managing them when you get home, but it's maybe a 2-week situation, so that's a possibility. If you or your family member are unable to work or attend school for more than 3 consecutive days and require ongoing medical treatment, that's another criteria that works for FMLA. If the person has a chronic condition that causes periods when the family member is incapacitated and requires treatment by a healthcare provider at least twice a year. So something that comes to mind with this is perhaps someone who has MS or another illness situation where there may be periods of crisis and there's ongoing medical attention. And during those periods of crisis, they need someone with them to help care for them. And just an FYI, this also includes pregnancy, including prenatal care, morning sickness, and bed rest. Just so you know. So sorry, I'm having trouble with the advancing part. So what does FMLA provide? So there's job protection. You must be returned to the same or a nearly identical job when you return from your leave. Your employer must offer insurance continuation if you're on the health insurance plan. You can't lose your health insurance while you're on FMLA. You're still responsible for any employee contributions you need to make. So if it's a plan where your employer pays part and you pay part, you still need to pay your part. Taking FMLA leave can't be held against you in employment actions like hiring, promotion, or discipline. It's flexible. As I said before, you can do a single block of time or small blocks of time or go part-time. And it's an unpaid leave, but you can elect or your employer can require you to use sick time, vacation time, or personal time. So that's something to ask your employer if you're considering this is, will they make you use your PTO or can you use your PTO? However, if you live in a state where you might be able to get paid leave, then that would probably be your source of income for that time. So state leave programs. And one thing about this, as I think I said earlier, is it's all layers. So FMLA guarantees, assuming that your employer is eligible and your situation is eligible. And in most cases that I know of, it is, but I'm just saying there can be times when it's not. That guarantees you the right to take the leave. State leave programs may also do that, but they also usually, except for one that I saw, are paid. Now it's not the same income that you'd be earning in your job, but it might be 60, 70, 80% of that, which can be helpful. So I've linked at the end to an article that you can read that basically lists the 16 states that have or will have paid leave programs, but this changes all the time. So be sure you ask HR if there's any state leave program you're eligible for. Regulations, requirements, amount of leave, and pay vary by state. Ask your employer. And also, if you do have a state program, call the program and ask questions. In Massachusetts, at least, I found them to be very helpful. And I will say, I will just confess, I don't think we're unusual here. Paid leave in Massachusetts started in 2021. It took us as a 1.5 person HR department a long time to be able to figure out exactly how it worked. And we called the state all the time and said, help us, we don't know what to tell people. But that's why I think it's really important that if you're considering it, you call the state yourself. They usually have hotlines and ask them your questions because it's all new for a lot of people. The states in some cases are figuring it out and HR departments are figuring it out. So make sure you have the best information available to you. And if you can get it directly, that's usually the best. So Massachusetts has had paid leave available for caregivers since January 1st of 2021. It applies to all businesses, state agencies, and in this state also to some contractors with some exceptions. It's funded by payroll tax, which I think many of the state programs are. So everyone who works has a certain amount deducted from their pay that goes to the state medical leave fund. You have to meet earning requirements, again, as with FMLA. You have to have earned $6,000 in the last 4 calendar quarters and 30 times more than you're eligible to get each week in benefits. Fortunately, there's a calculator for that. You can take up to 12 weeks in a benefit year. Benefit year starts when you first start the benefit and ends a year after that. And you'll need, again, to provide medical certification, which makes sense. So who can you care for? Who can you take caregiving leave for in Massachusetts and care for? It's actually a little broader, I think, than the federal definition. You can care for your spouse or domestic partner, your children, your parents, your spouse or domestic partner's parents, your grandchildren, your grandparents, or your siblings. But again, you'll want to check in your state and see what it says. What activities qualify? Providing the daily living needs that the family member can't perform due to their serious health conditions, such as dressing or feeding. Providing transportation to the doctor or for treatments. Providing support for mental health conditions, such as taking them to therapy or for medications. Or making arrangements for changes in care, such as transfer to a nursing home. In addition, again, the leave can be taken continuously. You could say, I need my 12 weeks all at once. You could do a reduced schedule and say, I'm working half-time for 24 weeks. Or you can say, I need 2 weeks now while my mom gets used to being at home after her stroke, and until we can move into assisted living, and then I'll need 2 weeks then, or whatever. As you can combine those types in Massachusetts anyway, as long as the total remains under 12 weeks per benefit year. So because there are so many layers and so many different programs you may be coordinating, your own PTO, any private insurance through your employer, your state program, your FMLA, it's important to speak to your program as soon as you know you may need leave and explore all the benefits for which you may be eligible. I can tell you that for the people who work for us, that's not just one meeting with HR. That's like constant asking questions, coming back, meeting again, us doing research, them doing research, and meeting again. Usually when they get to the point they're actually applying, it's great, because then the state basically takes them. It's a system, there's a system, there's like there's a continuum, and it just, it all sort of moves on from that point. But don't be afraid to go back to HR and ask questions and ask questions and ask questions. It's really important to determine how the benefit programs work together and which ones take priority. Because I don't know if I mentioned this, but in our state, for people who are taking the leave for themselves anyway, where I work, we do have a employer-funded program. We have a state program. The state program takes priority over the employer-funded program. So, but you have to apply to both if you're applying for leave. And the employer-funded program pays you $25 a week, just so they're paying you something. But the state money really is where the bulk of your income is coming from. So it can be very confusing. And again, don't be afraid to call programs directly. So another thing to think about is, while you're on leave, what your relationship is with your employer. It's really important to keep your employer informed of your expected return date. And we all understand, I think, that may change. But it's really good for the employer to know when you might be back, if you might not be back when you say you're going to be back, or if you're going to need, let's say you're on full-time leave for 2 weeks, if you might need part-time leave for 2 weeks after that when you return to work, or if you might need time off for appointments after that, because it helps them to plan. Some companies, some leave programs have communication boundaries when you're on leave, where the employer is not allowed to reach out to the employee about anything related to work except date of return. Some have different policies about that. So ask before you go on leave, like, what should I expect? When should I be in touch with you? For some programs, for some companies, you're not really allowed to call the person on leave and ask them any questions about the work while they're on leave. That's probably the best policy. So it's important to make clear that that's their expectation as well as your expectation. Make sure you supply all requested documentation when it's requested. I know it's really hard to get doctors' offices to fill papers out, but sometimes if you say, I need this from my employer because I'm going to lose my benefit if I don't get it to them, that will light a fire under them. And sometimes HR can call them too. I've called offices for people and said, we need the documentation. And remain aware of deadlines, so you don't miss any deadlines that disqualifies you from your leave. I've included a few links here, which you'll get with the PowerPoint. Just one to a really handy book on FMLA, and one, if you happen to be in Massachusetts, on a really handy pamphlet on paid family medical leave in Massachusetts. I included an article on states with paid leave as of September of this year, but again, it's changing every day. So, you can use that as a guideline. It does have links to some state programs, but always check and see if it's changed for your state. And then I just wanted to mention that Denise offers a great workshop on reimbursing family caregivers for their work, and I think there's one coming up, so you might want to click on that as well. I think she mentioned about family members paying caregivers from their family, and that's what that's about, and that's a resource for you, if nothing else comes through. And here will be ways to reach me. If you want to reach out to me after the presentation, after the workshop. And I think that's it for me. So I don't know if anyone has any questions or comments.
If you have questions, feel free to post them in the chat room. And something that you made me think of, Kathy, is that doctor's certification form. You could actually ask the doctor, your Carrie's doctor or your doctor, if you're going to take leave for yourself prior to needing that. What's the process if I need to take a leave to get my documentation and certification from your office? Because that can be a nightmare. And my sister started FMLA after my brother died, and trying to get my mom's doctor to sign the certification did take a little bit of a runaround. It was dropping off the paperwork, following up with calls to say, when will the paperwork be signed and ready for us to pick up? So have that conversation with the physician early so you know what the process is. And then the doctor is ready, hopefully, or the staff is ready to help you expedite that certification that needs to be signed.
That's a great idea, Denise.
Yeah, it just reminds us of how important it is to have these communications and conversations early and often. The other piece of it too is that talking to your employer is helpful because your employer might be in a state that has different benefits available than the state you live in, but your employer might be required to offer you the same benefits of someone who resides in the state where your employer is headquartered. So it can be complicated to figure it out.
Yeah. We actually ran into a situation like that in my family with leave for an illness, where the corporation was in one state, but it works in another state. And so it was very different. One other thing I don't think I mentioned that I want to mention is sometimes people are worried, like, I don't want to talk to my employer because I'm afraid that, I'm not getting along that well with them, and I'm worried I'm going to lose my job. Once you apply for that leave, your job is protected. Like, they cannot fire you at that point because you're on leave. And so if you're going through the leave process or your leave is granted, you're on leave. So I've said that. I had someone who was very worried about applying for leave come into my office. I'm like, just fill out the paper, just write an email saying you're applying for it and you're set. Don't worry about it.
And your employer might actually have a service they use to manage leaves. So it might be HR has contracted out with a provider for FMLA or your other paid leave. So they might actually refer you to an organization that actually manages the leave. So it's important to know who's the point of contact, which is why you want to start the conversation early. You just might not know that there actually is an FMLA provider that your employer contracts out with. So you want to make sure you know. Again, you don't want to be doing this at midnight on a Monday because you need to start leave on a Tuesday. That's why you want to think through, what does this look like? What are the benefits available for me? How do I have the conversation?
Exactly.
Okay. Anything that we missed in this part of our workshop? Anybody think of anything else? Okay. I just want to reiterate something about what happened with my sister. So my brother died unexpectedly, and my sister had a terrible employer experience after my brother died, which is what triggered her request to take a family medical leave. I think it's interesting about the relationship between us and our employer. And correct me if I'm wrong, Kathy, but I don't think you'll ever jeopardize your relationship by being proactive about understanding what benefits are available to you and being the one that manages the benefits so that you're using them efficiently and effectively.
Absolutely.
Yeah. Because I'm sure, Kathy, you've had situations where employees have reached out to you at 5 p.m. on a Monday and said, I need to take a leave starting tomorrow. Yeah. And what's that like for you, Kathy, from the HR perspective?
It's pretty stressful. I mean,
Yes.
certainly we want to do everything we can to support our employees, but it's hard. Of course, usually if the employee's in that situation, I mean, sometimes, as you know, things can happen. There can be a car accident and,
Right, yes,
there's a choice.
absolutely. Yes,
There's
right, yes.
So you do whatever you can, but it's hard also if you're, to be honest, I think this speaks to your point about planning. If you end up in a crisis situation as the employee, you're not thinking clearly. So you're not absorbing all the information either. So as you said, it's better if you can plan ahead and then you could have time to read the information, absorb the information, make the phone calls you need to make.
Okay. I think we're going to stop for now. We're going to take a 9-minute break. I'll see everybody back here at top of the hour.